Hi, Dr. Rubin. How are you?
Hi, Tatiana. So good to see you. Happy to be here.
So, you are the founder of the Scene Hair Care line. Usually, here we talk about treatments and different procedures people have undergone, but I think this is such an interesting real patient story because your story helped found this wonderful hair care line. Okay, so what skin concerns were you dealing with that led you to dig deeper and start your hair care line?
Yeah, I actually never sought to create a line. I'm trained as a pediatric laser surgeon, and I spent a lot of my career treating babies and kids with disfiguring birthmarks and scars. But I noticed a pattern. Every time I would go get my hair done at the salon, about 5 or 6 days later, I would break out. I'm 50. I'm still acne prone. I've been acne prone my whole life. So I actually started to keep a lab notebook and really control for any other variables because I'm like, okay, could it be this? Could it be that? But it was actually my hair care causing me to break out. And, I call it a confidence injustice because to be doing all the right things with my skincare, I'm a dermatologist, but many people see a dermatologist who have acne. And then to undo some of that with your hair care just felt wrong to me. So that's why I created Scene, which has really evolved. My story was around acne, but just to be there's a real white space and unmet need for good for skin hair care for people who struggle with acne like me, or I'm also I have sensitive skin. I'm eczema prone. People who have dry scalp. So that's really the origin of how Scene started.
And what was the process like? Were you cutting out certain things, looking at your diet, looking at the skincare products you use? How did you land on figuring out that it was your hair care that was causing some of these issues?
Yeah, absolutely. So, as I mentioned, I actually would keep a lab notebook. So I was like, I'm going to control for all other variables. I'm not going to change my diet. I'm not going to change my skincare. I'm not going to change my supplements. I'm going to pay attention to, what time of the month it is. And it was just this repeated pattern. Interestingly, for me, for hair care or a skincare product to cause an acne breakout can take a few days, 3 to 7 days. And I think that's probably the case for a lot of people. If it's irritation or eczema, it can happen a little bit quicker. So it's like a tricky pattern because as you're, mentioning, there's so many variables, but really the time where I was like, okay, this line needs to come to being was when we actually did a study showing that even when you rinse hair care products out of your hair, so once you rinse shampoo and conditioner, you rinse and forget, but there can actually be a thin film left behind on your scalp, your face, and your body, which explains why hair care can contribute to skin issues. And for me, that was like a really pivotal finding because when I was breaking out from my hair care products at the salon, I said, okay, I'm not going to use any leave-in products. I'm just going to put my head back, shampoo and conditioner, rinse, it'll be fine. I was still breaking out. But again, there's this residue that can get on your skin either in the shower or that gets deposited on your hair and then makes its way onto your face, your back. You're rolling around in your hair care products all night,
Right.
basically via your pillowcase.
And were you able to pinpoint which ingredients were causing concerns, or is it just a mixture of different things?
I love that question because I think lots of brands are a little bit of a marketing story, like an ingredient story. And my business partner is my brother-in-law. He's amazing. His name is Greg, but he likes to say like Scene isn't the brand where it's a secret ingredient that was picked at the top of the Amazon on the fourth Thursday of the month with a golden glove. And
Right.
it's a mixture of ingredients, and I wish it was as simple like as avoid ingredient A. I mean,
Right.
there's certainly some things if you're acne prone, like, coconut oil is highly comedogenic. Um, a lot of gels and hairsprays, they have polymers, which can be challenging for the skin. So there's a number of ingredients that are kind of, yes, let's try and avoid those. But there's a whole bunch of sneaky ingredients that have chemical names that, we're not trained to look at. And it turns out actually also it's not just the ingredients, but it's the amount of the ingredients. It's the way they combine. Like, for example, we took silicones out of Scene. I actually don't have a problem with silicones generally, but in the case of hair care, I think they can trap other ingredients on the skin and lead to clogged pores. So it was really a 4-year process to develop the products. I had a spreadsheet of over 400 ingredients, but a lot of it was just trying many, many formulations.
We are hearing so much right now about scalp care. So, why was it important to create something that was skin friendly and scalp friendly?
Absolutely. Well, I mean, there's this term in the industry called the skinification of hair, which I think a lot of people use to refer to scalp care when we're taking skincare ingredients and bringing it to hair care to really nourish and support the scalp. But I think, the concept of skinification of hair can be taken a step further, like we do at Scene, because your hair care not only affects your scalp, which is skin, by the way, but your face and body. So it's just really important that hair care is great for the scalp, but also for the skin generally. And, the way we define that is making sure that final formulas are tested to be non comedogenic so they won't clog pores, non irritating, safe for sensitive skin. We have the National Eczema Association seal of approval for our fragrance free products. And then our fragrance free shampoo and conditioner have the National Psoriasis seal. So I think, the scalp is essential for healthy hair growth, and making sure that the scalp is treated well is important. But again, just this impact, which, I really didn't even know when I trained as a dermatologist. I knew a little bit about it. There were some conversations about pomade acne, but the true impact hair care can have on the face and body, I think is bigger than many people have realized.
I think it's such a shame to put so much work into treating the skin and then forgetting this last final piece of the puzzle, because I know it's such a big concern for so many people and acne is so hard to treat. So I think you've unlocked another secret treatment option for people who maybe have not considered that in the past.
Yeah, I think so too. And when I was getting acne from my hair care, I was like, okay, is this just like I'm, you know, an outlier? We actually did a
Right.
study though, just to figure out how big of a problem this was. And it was a dermatologist graded clinical study. We gave seen to 27 patients with mild to moderate acne. And then the dermatologist at the end of the study looked at their face and body acne. And it was pretty amazing. 52% of people with face acne had shown improvement at 8 weeks, and 70% with body acne. Now, they didn't clear completely, but they had enough improvement to meet the criteria for the dermatologist gradings. Again, like you said, it is a shame. Like, you invest all this in your skincare, and then you could potentially undo it with your hair care. And, we're called seen because if your skin or hair don't look good, many people don't feel as confident being seen.
Yeah, that's so true. And hair loss is a big growing concern right now. What are your thoughts about hair loss? What's driving it? And what should patients be thinking about when choosing hair care?
Yeah, absolutely. I mean, the most common causes of hair loss are androgenetic alopecia, so male or female pattern hair loss that runs in families. And then there's something called telogen effluvium, which is a temporary type of hair loss, which can happen. It's happened to me after a stressful event, but it can happen if you have a stressful event, COVID, major illness, pregnancy,
Weight
thyroid,
loss.
weight loss. Exactly. With the
Yeah,
GLP-1s, actually, a lot of the hair loss that we see there, is telogen effluvium. It's a shift in the hair phase, and it's temporary, but it's pretty alarming because it happens
right.
for a couple months, and then it grows back. So, you know, I do think that hair care products that support scalp health are very important to healthy hair growth. I mean, certainly if someone's dealing with, not a temporary type of hair loss, there's medicated options, topical minoxidil. We now have oral minoxidil, a number of other options. But I do think using hair care products that support the scalp health are really, really important. We actually did a study showing that actually the head of the Harvard Hair Loss Clinic came to us, and we looked at fragrance free scene for 6 months in a randomized control study in women with female pattern hair loss. And at the end, there was 44% less hair shedding compared to control. And I think that's just because when you use hair products that support scalp health, it just helps the hair follicle, as for healthy hair growth.
Amazing. And you have this unique experience of being, a physician and also the founder of a brand. How do you think your experience being a doctor helps shape your approach to starting scene?
I think being a doctor, like it's kind of amazing to me that there's not more dermatologists founded hair care, because if you think about the fact that scalp is skin, and then also this idea that hair care really is skin care because what you use on your hair can affect your face and body. So to me, I've just taken the lens of, okay, is this going to be good for the hair, but is it going to be good for the skin? Like, will this ingredient clog the pores? Is it a common irritant? Is it a common allergen? And we can consult top contact dermatologist specialist, so that's a skin allergy specialist. But really, the lens of the dermatologist. And then I think there's a third piece other than patient, which is I have this sort of very frizzy, dry, curly hair. And so I think, being a woman and using a lot of hair products was really key. And actually, we had a couple rounds of chemists, and it really wasn't until we had another woman who happened to have curly hair, who really understood the hair conversation. Because I've never been someone that can just like wash and go and feel confident
Right.
with my hair. So it's
Yeah.
really just like that. It's the dermatologist, it's the curly, hair that I use so many hair care products, and being the acne prone, I think it was like the perfect trilogy.
Combination.
Yeah.
Well, also too, I've noticed during our conversation all of the clinical data that you shared too. So I think having that background, really knowing that you have to prove that your products are useful, effective, and safe is really important too.
Yeah, Tatiana, I think thank you for saying that. But yeah, I mean, we've shown, and published in peer-reviewed dermatology journals that hair care products can leave a residue on the skin after hours after using them, which is why we consider hair care to be skincare. We talked about the acne study, the hair shedding study. We also have a study in dry, flaky scalp. But anything we do, like I don't want someone to buy a product unless it's really going to work. And I think another just amazing part of Scene is that many people just use Scene for the hair experience. So it turns out when you optimize hair care for the skin and scalp, it actually, in the case of Scene, we've also created hair care that just gives you stronger, smoother, healthier looking hair. It's clean, vegan, cruelty free. So, I consider it like next generation hair care. I think once people realize
Yeah.
hair products can affect the skin, I don't think they're really going to be that excited about using hair care.
Absolutely. And I think it's a good option for teenagers and people who are having hormonal changes. You're in the thick of it. Why not get ahead of it? And it's a full holistic, 360 approach, not just your skin, but also your hair, your food, everything.
Yeah, absolutely. And, we have everything comes fragrance free at Scene. And I think it's just been amazing how many people who've struggled with, eczema or sensitive skin who've said all along, I thought my skin was the problem when, it turns out some of the products I was using, including my hair care, were contributing. And so again, we're not saying Scene is a cure for acne, a cure for eczema. If you are eczema prone, it's great to have a fragrance free line. And, we have not just shampoo and conditioner, but a whole line of products, which I think differentiates us because, if you need to use fragrance free because you have eczema or a fragrance sensitivity for another reason, you don't want to compromise on the hair experience and you want to be able to use, full range of products.
Wonderful. Well, thank you so much for coming and sharing your real patient story with us. I think if this introduces Scene to a lot of people who might need it, then I think that's amazing as well. So thank you.
Thank you for the opportunity. It's really been a pleasure.
Thank you.